Head of the Trust, Satnam Hospital, dignitaries on the dais, off the dais, friends, colleagues, members of the press.
Dr. Agarwal organizes conferences updates over years. And every time I see impressive news conference, most of you must know that almost similar conference meeting as I had about today on the subject covering the same subjects. But still he has done good impressive conference in the time of inauguration meetings, mostly attended by the delegates. Inauguration now is just a formality to a lot of we have seen like this now. And chief guest is also universal. I am not chief guest, I am one of the hosts only. But by now we only congratulate for the team and welcome all. Already a lot has been spoken on cancer and a lot you are going to update yourself over last today and tomorrow. Everything being discussing on. Full-fledged radiation oncology department, thoracic surgery department, and head and neck surgery as well. So as was said, these are three most common type of cancers which exist in our society at this point in time. And the numbers are going up so very rapidly that in the next 10 years, the numbers are likely to double from 15 lakhs to 30 lakhs. There are several new areas of development in the field of each cancer, and therefore we as oncologists have a huge ask from the administrators, whether they are hospital administrators, whether it's from the political side or from the NGO side, etc. So I can't go on and on for long. So there's a few things which I think we would like to impress upon is the prevention part. So I think prevention for breast cancer is very important because the numbers are rising so very rapidly and it's a lifestyle disease. So people have to maintain their weight, have to have a good healthy lifestyle to reduce the load of health. What we are covering here is the cervical cancer. So the vaccine for cervical cancer has become missed out, but they had in the sessions. As to say, smallest 50 is greater than the grandest intention. So I would request you to give a big round of applause for carrying on for 28 years an endeavor to make such an impact for this time of the world. It's really a joyful part of an event or an endeavor to make cancer known to everyone. And the conference is not just about the information you share, it's also about the ignorance you share. Things you don't know are more important to find out so that you can fix them. So I'll start by thanking all and everyone sitting in this hall, thanking God for making it all happen, thanking people who managed the event so beautifully, starting with Mr. Tarun and also our coordinator and the one who took care of almost everything, Ms. Vandana Mishra, I think she requires a round of applause too.
Chemo did derive a 15% more benefit, tending about to 40%. And that's how more trials like Dynamic trial again showed the same thing, the Intercept trial again showed the same thing, and Altair trial again showed the same exact thing, that if you incorporate these tests in your clinical practice, you will be able to identify those subgroup of patients where you can either de-escalate, escalate, or you can still keep the patient on observation. So this will be the last 2-3 slides where 68-year-old male patient presented with colicky abdominal pain and distension. He has a history of progressive constipation for the past 6 months with no prior colonoscopy. And the baseline CEA was 4.2. It was an obstructing mass, and he did undergo surgery. It turned out to be
numbers needed to treat. Abemaciclib you need to treat 13 to rescue 1, ribociclib you need to treat 20 to rescue 1. So that helps make decisions in clinic. By all means, use it. In terms of side effects, I raised one issue with ribociclib, common side effect is neutropenia. Just to say, the neutropenia that you get with CDK toxicity is just not as bad as the neutropenia that you get. These patients don't get sepsis. They get neutropenia, but they don't get sepsis. You cannot have people walking the street with neutropenia. You still have to talk with us, but these patients don't get sick with the neutropenia. So in terms of considerations in the differences of the trial, is that Natalie has 30% of patients that have negative disease. That's the main difference, but I do the data bit, but still if you take a very high risk patients with common genes and deltas as patients on Abena do. You still have to do the ECGs with ribociclib, and you cannot give tamoxifen with ribociclib because of the long treatment.
So in the initial staging, it is definitely recommended because it has better sensitivity for autoimmune than metastatic disease. And in pre-operative assessment, various studies have compared, and they have 30% of the cases have been upstaged, and unnecessary treatment and curative after attempts can be prohibited. And also for restaging after induction of therapy. High false positivity rate at 27% and positivity rate at 15%. So in these cases, tissue diagnosis is the answer.
There's a heart beating there. The question is, when you have that there, it's very easy exposure that happens there, and it's a big problem. You know, it's best as
It has more to cross, that is why initially also it was approved with the CNS metastasis. But basically what this, if we extrapolate from the slides what we saw.
Dr. Tanya Chhabra will be speaking on the art of localization by jobs.